Action.
Hi, my name is Emily. I'm going to do a head-to-toe assessment on you. Can you tell me where you are? Your room. Can you tell me what month it is? April. Can you tell me who the president is? Donald Trump. So that assessed her level of consciousness. Can you tell me what you ate for breakfast?
Nothing.
Okay, so then that shows her cognitive function. And in the meantime, I can assess her speech, that it's clear. I can assess her overall skin color. I already did the Snellen chart for cranial nerve 2. I got her height and weight. She's 5'3", 120 pounds, so her BMI is 21. I already got her vital signs. Her blood pressure is 120/60, her heart rate is 70, her respirations are 18, her temperature is 98.6, and her pulse ox read 100. So then I will inspect and palpate the skull, noting the size and shape. I will palpate the temporomandibular joint. I will palpate the maxillary sinuses and the frontal sinuses. I will note facial symmetry, noting the eyebrows, the eyelids, her cranial nerve 7. So assessing her eyes, I'll do the 6 cardinal positions of gaze. So if you could follow my finger. And then accommodation, sorry. And then inspect the conjunctiva and sclera. Oh, and then the positions of gaze and accommodation, tested cranial nerve 3, 4, and 6. And the pupillary light reflex for cranial nerve 3, 4, and 6. Her pupils are equal, round, reactive to light and accommodation. And then I'll palpate the nose and inspect the nose for any lumps, masses, pain. I'll test the patency of each nostril. And then I'll inspect and palpate the external meatus for any lumps, bumps, pain, tenderness, and the internal auditory canal for any cerumen. And then I'll do the whispered voice test for cranial nerve 8. So can you repeat back what you hear? Watch. Bed. Okay, so then that's cranial nerve 8. I'll inspect her lips. Can you smile for me? Her teeth, her gums, can you open? Her tongue, underneath her tongue, her palate, her tonsils, her uvula, and then can you say ah, ah? I'm going to note the rise of the uvula for cranial nerve 9 and 10. Can you stick your tongue out? The tongue is midline for cranial nerve 12. Can you shrug your shoulders? That's cranial nerve 11. I'll inspect the neck, the glands, the thyroid glands, and I'll palpate each lymph node. So we have the preauricular, postauricular, submental, submandibular, jugulodigastric, superficial cervical, deep cervical chain, occipital, posterior cervical, and subclavicular. And then we'll assess the upper extremities. So we'll note the overall skin color, the skin temperature, the radial pulses. We'll do capillary refill, and then look at the profile sign. And then we'll assess the range of motion. So can you bend your elbows, bend your wrists, put your shoulders up, and then we'll test the muscular strength. So can you, against resistance, can you squeeze my hands? And then I'll inspect the anterior chest, noting use of accessory muscles, and then I'll also inspect the posterior thoracic cavity. And then I'll also note her respiratory rate, rhythm, and depth. And I'll listen to her anterior chest in 5 spots using the diaphragm. So if you can breathe, breathe, breathe. 4, 5. And then I'll be noting the bronchial sounds are high pitched, The bronchovesicular are medium pitched, and then when I go to the back, the vesicular sounds, they should be a lower pitch. So for the 9 spots in the back. 1, 2, 3, 6, 7, 9, and then I'll also note, listen to the 3 lobes on the right, and then the 2 lobes on the left. And then I will listen to her heart, so I'll listen with the bell and the diaphragm to the aortic and the pulmonic and the mitral and the tricuspid, noting S1 and S2 and noting if there's any bruits, S3s, murmurs. And then with her head of the bed at 45 degrees, I can, with her head turned, look at any jugular vein distension. There shouldn't be any. Okay, so if you could lay down, I'll inspect the abdomen. Ow. I'll inspect the abdomen. Ow. Okay. I'll note the contour from the side, and then the symmetry at the foot of the bed. I'll inspect her umbilicus and note any pulsation from the aorta. And then I will auscultate with the diaphragm in all 4 quadrants. And then using the bell, I will listen to the aorta and the renal arteries. And then I'll do light palpations in all quadrants, and then deep palpations. Okay, you can sit up. So then I'll assess the lower extremities, noting over skin color and if there's any lesions. I'll assess the skin temperature, and then I'll do the pedal pulses, assess capillary refill, assess for any pretibial edema. And then I'll assess her range of motion. So if you could do the dorsiflexion and then plantar flexion, and then if you could bend your knees. Okay, and then can you do that against against resistance for strength? And then can you lift your leg for 5 seconds? Okay, and then the other leg for 5 seconds, and then assess her neurological function. So we'll do the light touch. So using this tissue, I'll have the patient close their eyes and let me know when they feel any sensations. And then I'll just instruct the patient that this is sharp and then this is dull, and then just have them just discriminate whether they feel a sharp or dull sensation. And then I'll have the patient stand up with their eyes closed, doing the Romberg test, and have them hold it for 20 seconds. Okay, you can sit down. I'll also do the, on the foot, do the Dubinsky reflex with, and then using a J, her toes shouldn't curl, and then we'll assess the quadricep reflex right here. And then with her arm resting on a table, we would assess the bicep flexion, the reflex, noting her fingers curling. And then I'll instruct the patient to walk with a normal gait. And then when you walk back, walk heel to toe. Okay, and then testing her cerebral function, if you could touch each finger to your thumb, and then rub your heel to your shin. Okay, and then I'll have the patient stand up again, and I'll inspect the symmetry of the spine. I'll have the patient bend over and touch her toes, noting any symmetrical of the spine and the thoracic cage and the concave. And then I will assess her range of motion, so if you could twist your spine without moving your hips. Okay, and then that completes the head to toe assessment.